Imagine this. It's late at night. You're home alone. The television hums softly in the background. Maybe you're reading. Maybe you're just about to go to bed. And then something feels wrong. It starts with a strange tightness in your chest. You think, maybe I overate. Maybe I'm tired. You get up, try to shake it off. But the pressure grows. You break into a cold sweat. Your left arm feels heavy, maybe even numb. A sharp, unfamiliar panic creeps in. You sit down. Something inside you knows. This isn't nothing. This is serious. This could be it. Now let me ask you, would you know what to do in that exact moment? Would you know how to react if your heart was failing and no one else was around to help? For millions of Americans, especially those over 60, this isn't just a hypothetical, it's a real fear, a moment that decides life or death. And the sad truth is, most people freeze. They wait. They tell themselves it will pass. But in a heart attack, waiting is the most dangerous thing you can do. That's why this video matters. Because by the time you're done watching, you'll know exactly what to do and what not to do if you're ever in that moment. You'll learn the simple steps that can buy you time, protect your heart, and maybe save your life. Let's cut straight to it. If you're having a heart attack and you're alone, these are the three things you must do. Immediately, first, call 911. Not your neighbor, not your doctor, not your spouse. Call emergency services. You may think driving yourself is faster, but during a heart attack, your heart rhythm can suddenly collapse. If you lose consciousness behind the wheel, the consequences could be fatal. Not just for you, but for others on the road. So don't risk it. Second, stay put and open your door. Unlock it so responders can get to you fast. Sit down or lie with your back supported. Stay still. Movement puts extra strain on your heart. Even walking across the room can make things worse. Third, if you have aspirin nearby and no allergies, chew one full-strength tablet or 2 to 3 low-dose tablets. Chewing helps it absorb faster. It won't stop the heart attack, but it can slow the clot, keep blood flowing, and buy you precious time. That's it. Just 3 steps. Simple, clear, life-saving. Because in that moment, you don't need a lecture, you need action. When we think of a heart attack, most of us picture the classic scene. A man clutching his chest, collapsing to the floor. But that's just one version, and it's far from the only one. In fact, many people, especially older adults and women, experience symptoms that are much more subtle. Sometimes there's no chest pain at all. You might feel pain in your back, or your jaw, or down your arm, not just the left, but the right as well. You might feel a dull ache in your shoulder blade that lingers for days. Some people describe it as pressure or a tight band wrapped around the upper body. You may have nausea or feel like vomiting. You could have dizziness, the kind that makes you feel like you're going to faint. Or maybe it's just a strange sense of unease, anxiety that comes out of nowhere, a feeling that something is very wrong. One woman shared that all she had was aching in her back and a slight numbness in her jaw. No chest pain, no shortness of breath, and yet she was having a full-blown heart attack. A former athlete in his 40s said he thought he'd torn a muscle in his chest after working out. Just a cough and a light twinge, but it was enough to send him to the ER and save his life. So what's the lesson here? Don't wait for the movie version of a heart attack. Don't assume you're fine just because you're not doubled over in pain, especially if you're over 60, diabetic, female, or have a family history. Your symptoms may not follow the textbook. Instead of asking, is this bad enough to call for help? Ask, is this different from my normal? Because different is enough, and different could be dangerous. So what actually causes a heart attack? It's not just bad luck. It's not just stress. At the core, a heart attack happens when blood can't reach your heart muscle. And without blood, your heart quite literally starts to die. Most often, the problem starts with your arteries, those blood vessels that carry oxygen-rich blood to the heart. Over time, they can become narrowed or blocked by a buildup of fatty deposits called plaque. That's what we call clogged arteries. But it's not always the gradual narrowing that causes the attack. Sometimes the plaque suddenly breaks open, like a scab tearing off, and your body trying to fix it forms a blood clot. That clot blocks the artery completely. Blood flow stops, the heart muscle starves, and the damage begins. Inflammation plays a big role too. It's like the spark that lights the fire. If your body is inflamed from a poor diet, smoking, high blood sugar, stress, your arteries become more unstable. That makes plaque rupture more likely. That's when the real danger begins. And here's the scary part. Half of all heart attack deaths happen within the first hour. Not because the ambulance was late, not because the hospital made a mistake, but because people waited. They didn't recognize the signs. They didn't act fast enough. Remember this phrase, time is muscle. Every minute you wait, more of your heart dies. So instead of wondering, is this serious? Assume it is. Instead of hoping it goes away, make the call. Because a blocked artery doesn't care if it's convenient. But knowledge and quick action can change the outcome. If you've recognized the symptoms and realized, I'm having a heart attack, the very next moments are critical. Let's break down what exactly you should do, step by step, to stay alive until help arrives. First, call 911. Immediately. Don't call your spouse. Don't Google symptoms. Don't wait to see if it gets better. Every second counts. And no, don't drive yourself. You might feel okay enough to get behind the wheel, but during a heart attack, your heart's rhythm can become dangerously unstable. A sudden arrhythmia could make you pass out mid-drive. That puts not only your life at risk, but everyone else's on the road too. Second, unlock your front door. Make it easy for emergency responders to reach you. If they have to break down a door, precious time is lost. Third, sit or lie down in a supported position. Choose a posture that doesn't strain your body. Sitting with your back supported and head slightly raised can help maintain circulation. Stay still. Don't try to pace, walk around, or shake it off. Fourth, keep pets in a separate room. As silly as it may sound, pets can get in the way during an emergency. Isolate them so first responders can do their job quickly and safely. Fifth, take aspirin the right way. If you have aspirin nearby and you're not allergic, chew it. Don't swallow it whole. Chewing speeds up absorption. A full-strength 325 milligram tablet or 2 to 3 baby aspirin at 81 milligrams each will do. Aspirin helps prevent blood clots from getting bigger, and in many cases, it buys you time by partially restoring blood flow. Sixth, avoid vasodilators like nitroglycerin unless prescribed and safe. Some people keep nitroglycerin on hand, but if you've taken medications like Viagra, Cialis, or Levitra recently, mixing them can be deadly. Also, in right-sided heart attacks, nitroglycerin can worsen the situation. So unless a doctor has told you to use it, don't. And finally, stay calm, even when you're scared. Panicking increases your heart's workload. Breathe steadily, slow your thoughts. Remind yourself, you've done the right things. Help is coming. It's not about being brave. It's about being smart. Because you don't need to be a hero. You just need to stay alive. Now that you know what to do, let's talk about what not to do. Because unfortunately, these are the mistakes that cost lives. Mistake number 1, driving yourself to the hospital. We've said it before, but it bears repeating. People often think, if I can just get there faster, I'll be fine. But during a heart attack, your blood pressure can plummet, or your heart may suddenly fall into a dangerous rhythm. 1 second you're alert, the next unconscious. Instead of speeding to safety, you could be steering into disaster. Mistake number 2, ignoring the signs. So many survivors say the same thing afterward. I thought it was heartburn, or I figured it would pass. They take antacids, they lay down, they wait. But heart attacks don't wait. They get worse with every minute. So instead of asking, is this serious enough? Ask, is this different? Mistake number 3, believing in so-called cough CPR. You may have heard it. If you're having a heart attack, start coughing really hard. It might save you. It sounds dramatic, but it's not medically sound. Cough CPR is not for heart attacks. It's for specific arrhythmias under hospital supervision, not a blocked artery at home. Coughing won't unclog your artery. It won't restart your heart. What it might do is waste valuable time while you could have been calling for help. Mistake number 4, self-medicating without guidance. Some people reach for nitroglycerin, herbal remedies, or old prescriptions. But without a doctor's instruction, this can be dangerous, even fatal. For instance, nitroglycerin combined with ED medications like Viagra can cause a deadly drop in blood pressure. Mistake number 5, downplaying it because the pain isn't bad enough. Remember, when pain is only one piece of the puzzle, anxiety, sweating, back pain, nausea, these can all be signs. Just because it doesn't feel dramatic doesn't mean it's not life-threatening. The bottom line? When in doubt, don't wait it out. Act, because doing the wrong thing during a heart attack can be just as dangerous as doing nothing at all. Let's shift perspective. What if it's not you having the heart attack? What if you walk into a room and find someone else, collapsed, not moving, not breathing? Would you know what to do? Here's what matters most in those critical seconds. First, check for responsiveness. Shake their shoulder, call out their name. If they don't respond, and especially if they're not breathing normally, assume it's a cardiac arrest. Second, call 911 immediately. Put the phone on speaker. That way, the dispatcher can guide you through CPR while help is on the way. Third, start chest compressions, hard and fast. Find the center of their chest and push down firmly, at least 2 inches deep, at a pace of 100 to 120 compressions per minute. That's the rhythm of the song Staying Alive. Yes, it's a bit ironic, but it's also unforgettable. Fourth, keep going until emergency responders arrive. Don't stop. Don't worry about doing it perfectly. What matters is you're pushing blood to their brain and heart, keeping them alive long enough to get a shock from a defibrillator. If an AED, an automated external defibrillator, is nearby, use it. It will guide you step by step with voice prompts. You can't do it wrong, but you can save a life. You don't need to be a doctor. You just need to act without hesitation. In those moments, doing something, even imperfectly, is always better than doing nothing. By now, you've heard that aspirin can help during a heart attack. But what about taking it every day to prevent one? That question comes up a lot, especially for folks over 60. The idea is simple. Aspirin thins the blood, so it might prevent clots from forming in the first place. Sounds smart, right? Well, it depends. If you've already had a heart attack, a stroke, or stents placed, daily aspirin is often recommended. Your risk of another clot is high, and aspirin can lower that risk. But if you're healthy or have never had a heart problem, the answer isn't so clear. Recent medical guidelines now advise against starting daily aspirin for most people over 60 who haven't had heart disease. Why? Because while aspirin can reduce heart attack risk slightly, it also raises your risk of serious bleeding, especially in the stomach or brain. For many, that trade-off just isn't worth it. The U.S. Preventive Services Task Force, a respected group of doctors, recently changed their recommendations based on newer studies. They now say don't start daily aspirin without talking to your doctor, especially if you're over 60. And here's something shocking. A national survey showed that nearly half of Americans wrongly believe aspirin is safe for everyone to take daily. That's not just outdated, it's potentially dangerous. So what should you do? Talk to your doctor. Ask about your personal risk factors. Get a full picture. Don't start or stop any medication based on what you hear online. Aspirin is powerful, but power used without guidance can do more harm than good. Here's the truth most people forget. The best way to survive a heart attack is to never have one in the first place. Yes, that sounds obvious, but prevention doesn't get the spotlight it deserves, especially for people over 60, because by then, we often think it's too late to change. But the science says otherwise. You can improve your heart health at any age, and the steps aren't complicated. They're just easy to overlook. Start with food. Your arteries don't clog overnight. The biggest culprits? Diets high in refined carbs, sugar, and inflammatory oils. Instead, choose real food, vegetables, lean proteins, healthy fats like olive oil or nuts. You don't have to be perfect, just consistent. Get moving. Even a 30-minute walk 5 times a week lowers your risk dramatically. You don't need a gym. You don't need fancy gear. You just need to move more than you sit. Sleep, stress, smoking. All of these affect your heart more than you think. Poor sleep raises blood pressure. Chronic stress inflames your body. And smoking? Still the most preventable killer. Know your numbers. Check your blood pressure, your cholesterol, your blood sugar. Don't guess, test. You can't manage what you don't measure. And here's something hopeful. Even if you've already had a heart attack, these changes still matter. They reduce your risk of another one. They help your medications work better. They give you back control. So instead of fearing what might happen, focus on what you can do today. Because your heart doesn't care how old you are. It only cares how you treat it. Starting now. Take a breath with me. We've covered a lot. Symptoms, actions, mistakes, prevention. But I want you to step back for a moment and think about why this all matters. Maybe you've never had a heart attack. Maybe you have. Maybe you've lost someone to one. A parent, a spouse, a friend. Maybe you're here because you're scared, or maybe just curious. But no matter what brought you here, you're walking away with something powerful, knowledge that can save a life. Let's be honest. A heart attack doesn't announce itself politely. It doesn't wait until you're ready. It doesn't care if you're alone, if the timing is bad, or if you've got a busy day tomorrow. But you can care. You can prepare. And you can be the reason someone, maybe yourself, gets a second chance. So here's what I want you to do. Share this video, not because it helps me, but because it might help someone you love, a sibling, a neighbor, that friend who shrugs off symptoms. Watch it again with your partner. Save it somewhere you'll remember. Write down the 3-step plan, post it on your fridge, and if you haven't already, subscribe. Because next time, we'll talk about clogged arteries, the real root cause of most heart attacks, and how to reverse the damage before it's too late. This isn't about fear. It's about power. Power to act, power to change, power to live. Your heart is the engine of your life. Protect it like it matters, because it does.